Good morning, everyone, and thanks for joining us for our Mayor's Wellness Campaign webinar, Unlocking the Power of Local Health and Data, How Mayor's Wellness Campaigns Can Leverage the City Health Dashboard. I'm Julie DeSimone. I'm the Director of Community Health here at the Quality Institute, and we will just cover a couple of housekeeping items before we get started. All of the phone lines will be muted for the duration of the program to limit background noise. The webinar is going to be recorded and posted on our website after the presentation. And we encourage you to ask questions by typing them into the chat box. We're going to try to answer the questions in the order that we receive them at the end of the presentation. So you can type those in throughout the presentation, or you'll have a moment at the end to type those in as well. Okay, so today you're going to have the opportunity to hear from Samantha Breslin, a Senior Program Coordinator at City Health Dashboard, and Deputy Mayor Iman El-Bedwi of Cranbury Township. During today's webinar, we're going to cover how you can leverage the City Health Dashboard to determine your community health's biggest health-related challenges and use it to inform your Mayor's Wellness Campaign programming, how to apply to the Put Us on the Map challenge and join communities throughout New Jersey on the map, and how to utilize the City Health Dashboard to help support your efforts to improve health and wellness equity for residents. And then we're also going to learn about how Cranbury Township is putting this data to use through their Mayor's Wellness Campaign. So I'm going to turn it over to our first speaker, Samantha Breslin.
Thank you, Julie. Thanks, Katie, for having me. So I'm Samantha Breslin. I'm the Senior Program Coordinator at the City Health Dashboard, and we are a project out of the NYU Grossman School of Medicine in the Department of Population Health. And I'm so excited to speak to you all today and kind of share how everyone on this call can use our data and the features of our website in their programs, their policymaking to improve health and equity locally for all residents. You can go to the next slide, Katie. So at the dashboard, our goal is to help cities across the US leverage the power of data to improve the health and well-being of everyone in their community. And next slide. And we do that by providing over 40 measures of health, the drivers of health and health equity for over 900 US cities at this point, in order to help them guide local solutions, guide policymaking, guide program implementation, and really make sure that they are having the impact that they expect to have with their various programs, and making sure that they understand what community health looks like at a local level. Next slide. And, like I said, I work and our team is based out of an academic institution. So it was really important for us to get feedback, perspectives, insights from local leaders, city leaders, across the country, people working in health departments and local governments, to create what we hope is this easy to use one-stop resource that you will learn more about today. So we were really developed and tested by community and city leaders, and we receive, constant feedback from local users on how we can continue to improve the site, upgrade our data offerings, upgrade our features, so the site remains resilient and resilient for local users. And we were developed in partnership, like I said, with city leaders, but also with the National Resource Network, ICMA, the National League of Cities, and NACCHO. Next slide. And while the dashboard was created to be used in any number of ways and was really created to be flexible depending on who the user is and what their need is of the data, I've listed out here 3 what I think are the most salient points to kind of hit when approaching the dashboard for the first time. So you can use the City Health Dashboard to compare health gaps across neighborhoods, for example. So I have pulled out on the right side of this slide a map of neighborhood level life expectancy in Columbus, Ohio. And I've highlighted 3 neighborhoods that are right next door to each other, less than 2 miles apart, closer to 1 mile apart from that neighborhood on the most left side to that neighborhood on the right, and yet residents living in those neighborhoods have very, very different life expectancies that range from 60 years to 80 years to 68 years. And so the dashboard is really useful in helping users identify those gaps, but also into figuring out and digging into what could be causing those gaps. Why is the range of life expectancy so large between those three neighborhoods? What is happening? What is the local experience of neighborhood or of the people living in those neighborhoods that could be contributing to those gaps and disparities? And so you can also use the dashboard to compare your city to cities in other regions or cities with similar demographics or population sizes. And finally, use the dashboard to help you set priorities and better target your resources. Everyone on this call knows that resources are scarce. Our time is scarce, money is scarce, expertise can be scarce sometimes when we're in smaller governments. And so the dashboard is a really useful tool for helping you improve your capacity and really make sure that you're having, or really make sure that, you know, the resources that you're targeting towards, whether it's like specific communities or specific challenges, are actually the communities and the challenges that are getting impacted by those issues. And so next slide. This is a quick note about measure selection criteria. As an academic institution, this is one of our most important pillars. We wanted the data and the metrics that we presented on our site to be, you know, rigorously collected. We want to be able to stand by everything that we put on the site. So this is a really, really important slide for us. But all of our data comes from national data sets. So things or data sets like the CDC, the National Vital Statistics System, which is like our natality and our mortality, birth and death records. Data comes from the EPA. And so what is great about that national data sets is that we're able to provide all of this data for our 900 plus US cities, but also in terms of driving comparison. So if we're looking at children in poverty in Cranbury, New Jersey, and Cranbury wants to compare themselves to a different city, for example, let's just say Rocky Mount, North Carolina, we know, or they know when they come to the site, that the way children in poverty is measured in Cranbury is the exact same way that poverty is measured in Rocky Mount. So like you're looking at apples to apples comparisons. Like I said, all of our data comes from data sets that have really rigorous data collection and analysis that we can stand by as an academic institution. Everything is unbiased, objective, all of those things. And then the next 2 points are, to me, the most important for the people on this call. So we wanted our metrics to not only reflect public health priorities and resonate with what local communities were doing or local governments were doing in their community, but also be amenable to city level intervention. So we didn't want to provide information on a challenge or an issue where, that unit or lever of change was not at the municipal level, but was at the county level or the state level. We wanted the organizations, the health departments, whoever, the mayor's wellness campaigns to come to our site and be able to actually move the needle on the issues that we presented and the information that they found on our website. And then finally, all of our data has to be updated regularly, usually around once per year, and is balanced over 5 overarching domains. Next slide. And so you can see all of our measures listed on this slide. There's a lot of information here. I don't expect you to kind of read through all of these, but so you can see all of our metrics fall into 5 different buckets. So we have health outcomes, social and economic factors, health behaviors, clinical care, and physical environment. And all of the metrics that you see listed in navy are available at the city level, whereas the metrics listed in that gold or yellow color are available at both the city and the neighborhood level. So a large majority of our measures are available at that census tract or neighborhood level. So you can really see and dig into, inter-neighborhood gaps. Next slide. And so let's dig into the dashboard a little bit. For the sake of time, we don't have, we're not going to do a live demo of the site, but I've pulled out some screenshots that I think can help orient us and kind of introduce the site and our features to everyone on this call. And so the dashboard is accessible to anyone, anywhere, as long as you have a broadband connection. And so all you need to do is go to cityhealthdashboard.com and you're met with this home screen. And all of our information, all of our data, I think it's really important to stress, it is free to everyone. We do not hold back anything by like a paywall or a pay gap. Everything is free and accessible to all of our users. Next slide. So if I had put in that home screen, if I had kind of typed in Rocky Mount, North Carolina, we would be taken to this metric detail page, like what you see here. And what's great about the dashboard is that, we designed it to be, accessible and useful to really anyone in their data journey. So we wanted the really novice data user to be able to find value in our site. And we wanted the epidemiologist or the data analyst or the PhD to be able to find value on our site. And so we are really intentional in supporting users wherever they are in that journey and making sure that they have the knowledge, the information, the tools to be able to understand and comprehend the data that we provide, the way we kind of communicate data, and really making sure that it's accessible to a wide range of audiences. So once you kind of understand how what the language we use is, or the symbols that we provide, once you kind of understand it for one metric in one city, you know it for every single metric in every single city. We do not change any of our symbology or our legends depending on the metric or the city. So this is the Children in Poverty metric detail page for Rocky Mount, North Carolina, a mid-sized city that we added that we added about 2 years ago at this point, when we kind of expanded our dashboard to include more smaller and mid-sized cities. And so on this metric detail page, you can see, there it says children in poverty in 2020. And so across all of our metrics, we provide multi-year data, or not all of our metrics actually, for a I think 98% of our measures at this point, we provide multi-year data, with some metrics going back to 2012 and 2013. And so when multi-year data is available, that 2020, you'll be able to click onto that and toggle between different years of data, so you can see how potential challenges may change from year to year in your city. We provide some information about how we measure children in poverty right below that. And then finally, in the middle of the screen, you can see that scale bar, that kind of range of blues. And that kind of represents the range of values for that city. So for example, in Rocky Mount, children in poverty values range from 0% on the low end to 62% on the high end. And across all of our measures lighter colors indicate better outcomes and darker colors indicate poorer outcomes. So for a measure like children in poverty, you of course want less of your children experiencing poverty. So that blue check mark in the circle and those lighter colors will be on that lower end of the scale. Whereas for a measure like high school completion, for example, or walkability, you want more of your residents completing high school or getting an equivalent degree. You want more of your residents living in walkable neighborhoods. So the lighter colors and that blue check mark in the circle would be on that higher end of the scale. And then the gold bar represents the city or the census tract value for that city, or for that measure. So in Rocky Mount, about 29% of Rocky Mount's children were living in poverty, compared to around 17% across the dashboard cities. And that dashboard city average is represented in that blue triangle. So Rocky Mount's has a a much larger percentage of their kids living in poverty when compared to that average for all of the dashboard cities. So that average it can be a proxy to the national average, but because we're only looking at the average of the cities that are kind of included on the dashboard, it's not a total one-to-one, but it's close to a national average. But again, that average, that 17%, is only the average of poverty for the 900 plus cities on our tool. Next slide. And so digging into the map, we can see here census tract or neighborhood values for children in poverty in Rocky Mountain. Like I said, Rocky Mountain's estimates range from 0 in the low end to 62% in the high end. And I've pulled out, again, 2 neighborhoods here that are right next door to each other, very close together in terms of just the distance between them. Yet on the right-hand side, we have a 0% estimate of kids living in poverty, and right next door 61% of children are living under the poverty line. What could be happening in those communities? What are the programs that we can maybe implement, or the policies that we can implement in that neighborhood that has 61% poverty levels to bring that down, or to move the needle, or to support the communities, or support the neighborhoods, support the residents living in that neighborhood, to make sure that they are getting the help and the resources they need to thrive. So again, the dashboard is really useful for kind of highlighting at a glance those stark disparities. Next slide. And we also provide about 2/3 of our measures, data broken down by race and ethnicity. So we don't want users to only get a sense of what challenges or issues look like from that geographic lens, but it was really important for us to integrate a racial equity lens as well. And so this shows us, what poverty, or how poverty kind of differs between the 5 major racial ethnic groups in Rocky Mount. And you can see, across kind of looking from Asian to Black to Hispanic to white, poverty really ranges. You have 0% for Asian residents, but they only make up 1% of the population. And then you have over 35% of Black residents living in poverty. So there's a lot going on. And this just helps us get that more complete, comprehensive picture of community health, and perhaps can help us, target our outreach or target our strategies so we are sensitive and we are inclusive of different communities in the work that we do. Next slide. And then another feature that we provide that I think is really powerful and important, and is sometimes overlooked by users, is the ability to compare 2 metrics at once. So as you all know on this call, when we're looking at challenges or issues like poverty or diabetes, like I have on this slide, these issues do not exist in a silo. They are very interrelated and interconnected, and intersectional with other various challenges that communities might be facing. We know that poverty and housing are very linked. Poverty and diabetes are very linked. And so we wanted users to have the ability to look at how 2 metrics may or may not kind of compare or relate to each other in their city, and really kind of take these things out of the vacuum and look at them from a higher level. So we have the ability to do that in 2 different ways. We have what I've shown here on this slide is that same map that we looked at for our neighborhood level value, our neighborhood children in poverty, where the blue polygons are the base map that represents our original metric, children in poverty. And then the pink or red dots on top of those neighborhoods represent our second metric, or our comparator metric, which is diabetes. And again, across all of our measures, lighter colors indicate better outcomes, darker colors indicate poorer outcomes. And you can see those same patterns that we saw in the previous slide, where the neighborhoods that have less poverty also seem to have lower rates of diabetes. And then the neighborhoods that are kind of on the right side of the city where poverty is higher, diabetes tends to be higher as well. And so we're able to see how in neighborhoods, what are the different types of challenges that community residents are facing, and how can these measures, or how do these measures move together in neighborhoods across the city. And just like a quick note, my the data team members that I work with would kill me if I didn't say that, just because two measures might be related or might be associated or correlated does not mean that one causes the other. And so it's important for us to remember that when looking at these maps. Next slide. And then moving from data to action, when we first built the tool, we heard a lot from users that, you've shown me my data, so what? How can I implement this in my community? And we have what we call the Take Action Center, which is a collection of over 400 resources that help you implement the data or move from data to action and better understand, what are the different tools at my disposal, the policies at my disposal that I can implement in my community. Next slide. And so a quick note about how local communities are using dashboard data. And I do want to be mindful of time that we're at 22 minutes. So I will go kind of through this next part quickly because I have more local use cases at the end. But next slide, please. So Glassboro, New Jersey, we did some work with the New Jersey Health Initiatives, which is the grant-making arm, or the New Jersey grant-making arm of the Robert Wood Johnson Foundation, who is our funder. And the Glassboro, they had a whole set of kind of teams where they were funding these teams across southern New Jersey, and we provided data for these small communities. All of these communities were under 30,000. And so the Glassboro team, which was comprised of university representatives, local government, community members. So they were able to identify poverty and healthy food access as top challenges for their community and use that information to administer surveys, hold interviews and focus groups in those specific neighborhoods that they identified as needing extra help, to better understand how those residents experienced food insecurity. And this work led to various recommendations that they had presented to the local city council for how to improve food access in those neighborhoods and how to improve access for their community. Next slide. And then in Grand Rapids, Michigan, the Invest Health group for that city, which is like a very large cross-sectoral initiative that brings together hospital systems, insurance companies, or health insurance companies, the government, funders, to kind of target investments and partnerships. They really relied on the income inequality, the unemployment, and the life expectancy measures to identify 17 neighborhoods that were struggling continuously across all of these different metrics to then focus and invest local health and equity projects in those neighborhoods and use that data to really back their monetary investments. Next slide. So the Put Us on the Map Challenge. This is kind of, I think, the reason why we're all here. The Put Us on the Map Challenge, next slide, is so when we first started, we provided data for only the 500 largest US cities, but it was always on our radar and it was always a priority for us to reduce that population threshold and include cities that were smaller in size. And we realized that, while it's great to provide data for the cities like New York and Chicago and LA, those cities aren't really the ones that need our data. And it was the cities that were smaller and more mid-sized that actually had the largest need and the biggest use case for the data that we provide, as well as the features that we provide. And they had the most to gain from getting access to our data. So as our team kind of honed in on our analytic methods, we have been able, and we have tried to reduce that population threshold continuously as we've grown and evolved since starting in 2018. And so the Put Us on the Map challenge launched last year, and we just relaunched it again in February. And this is a free, I want to stress, a free opportunity for residents, local governments, community members, community organizations from smaller cities to apply to have their city added to our website in summer 2023. So the cities will be selected this spring. The applications close on March 1st, and we will make the announcements of the selected cities around April. And then the actual city data will be added to our website this summer around July. Next slide. So who can apply? So any US city, township, I know is a big, is like a geography that is very common in Jersey, boroughs, villages, any city or place that has a population of 3,000 to 50,000 is invited to apply. And like I said, we want individuals or teams that are represented or that are consisted of community members, policymakers, government leaders, to apply for their city and to kind of show where possible that the data can be used in cross-sectoral collaboration or partnerships. That is a bonus, but is not a prereq. Mostly, we want to see just the 3K to 50K threshold, as well as we want people to tell us, how can data be useful? Why will data be useful for their city? Next slide. And so what will the selected cities get when they get added to the dashboard this summer? So the first is access to their city's data on our website and all of our features. And I've listed all of the metrics that will be available to our smaller cities when they get added this summer. You'll see, I said earlier in our presentation that we have over 40 measures of relating to health and the social drivers of health, but there's only 32 on this slide. That is because not all of our data sources provide data for places or geographies that are smaller than 50,000. In some cases, when you're getting into smaller and smaller units, the data becomes more sparse and we come into privacy issues, or the data just become not reliable. And so we can't provide data for those metrics where that could be the case. So we have 32 measures that will be available for the smaller cities. But again, that's still a lot of information that will be available to you. And a majority of our metrics will be available to you. The selected cities will get support from our team. I make myself available to all of our cities that get selected to do webinars like this, or really work with you hands-on, one-to-one, to better understand what your data looks like and how you can put it into practice. Next slide. And so how to apply. We have a very easy application form. I can put that in the chat once a little bit later. And then again, tell us why local data is important to you in your city and what you hope to accomplish with the data. And we don't want this application to be, it's not meant to be time intensive. It's not meant to be resource intensive. It really shouldn't take you longer than, 30 minutes max. And then applications close on March 1st at 5 p.m. Next slide. And then this is just, again, the timeline, but I think I kind of talked about that just for the sake of time. Just go to the next slide. And then spotlighting the 2022 Put Us on the Map cities. And I think this is a great segue to the conversation that Julie and Iman will have after I kind of am done sharing. So how are last year's winners putting the data into action? Next slide. So Hillsborough, New Jersey was one of the selected cities, and they wanted to better understand how COVID impacted their residents. So they used our COVID local risk index, and they were really more focused on seniors. And so they looked at the COVID local risk index, the preventative services measure, which is focused on seniors, as well as our uninsurance measures to determine which populations they should kind of allocate or target for their various vaccine promotion, their rapid test programs, their COVID their COVID education, and kind of outreached accordingly to local apartment complexes that had seniors in those neighborhoods to make sure that they were getting the resources that they needed to improve COVID awareness and vaccine uptake. Next slide. And then becoming nationally accredited in Marietta, Ohio. So Marietta, Ohio was applying to become a nationally accredited health department. And part of that process, they needed to implement a community health assessment and a community health improvement plan, but they didn't have a lot of data at all looking at their city. So they looked at pretty closely, or they plan to look at and integrate our children in poverty measure, diabetes, high blood pressure, insurance and housing, lead risk and housing metrics, along with our racial ethnic data to understand their community challenges and then drive their implementation strategy of their CHA and their CHIP in order to support and buttress their application to become nationally accredited. And they had to be able to show in those applications that they had a good sense of data, how to use data, how to interpret data for their application. Then next slide. And then finally, deploying farmers markets or mobile farmers markets in Petersburg, Virginia. So this team, they kind of saw that, you know, their residents were really struggling with healthy food access, obesity, diabetes, poverty. And so these are all kind of measures that go hand in hand. And so they use that information to identify, you know, key neighborhoods that were struggling across all of those different metrics to place their mobile farmers markets in that city. And they also were able to use the Compare Cities feature for a research proposal that focused on, you know, various planning and evaluation of community-led programs to address health disparities and improve health equity. So these are just three examples from last year's winners of how data was used. And I look forward to hearing more from Iman on how Cranbury used the data in her conversation with Julie. So that's the end of it for me, Katie. And so we could go back or kind of segue into the conversation.
Great. Thank you so much, Samantha. That was so much great information. And as all of you on the call know, that data-informed programming is something that we really strive for with your Mayor's Wellness Campaign. So this is such a great tool, and we're so excited to have shared this information with you all today. And so now we're going to move in, as Samantha mentioned, to a conversation with Deputy Mayor Iman El-Bedwi from Cranbury Township to hear a little bit more about how they were able to utilize this process over the last few months. So we will start there. I just wanted to, as we're kind of walking through our conversation, if those of you on the call can just use the raise hand emoji to indicate if you had heard about the City Health Dashboard prior to today's training. I just think that would be interesting for us to know, and maybe Katie, you can just make a note of that. Okay. So we'll get started. Again, Deputy Mayor, thank you for joining us today. We really appreciate your time. And we'll just kind of start with, if you can walk us through the process of how Cranbury got involved with the City Health Dashboard.
Absolutely. So thank you for having me here today. And I am very excited about this because everything that you all heard on the slide presentation just now is pretty much what we went through last year. We were a brand new chapter of the Mayor's Wellness Campaign, and not entirely brand new, but newer to these activities. And we have a wonderful chairwoman, Laura Zerflu, who said, let's start delving into some of these activities. And the email started coming in, and the Put Us on the Map challenge arrived. And that was February of last year. So we literally are exactly a year from the time that we started this process. And so it's a very simple, almost application that you all put out there. And it asks some very standard questions, and it has to do with how your town is run and, you know, activities and what will you do with the information. And I found that interesting. And I thought to myself, we don't really know what this is. We don't really know what this tool is going to offer us, but it is going to offer us information. And so it's something we don't currently have.
Yeah, that's such a great mindset, right? Like you don't have to have the full plan mapped out, but it gave you some time to really think about what you're doing in your community as you're filling out that application. So even that probably is helpful to the process. Samantha mentioned that it's about, less than 30 minutes for that application. Did you find that to be the case? Just for folks as they're
I did. I
great.
did. And what was really nice is that at the time, Mayor Barbara Rogers was actually actively with us as well on the Mayor's Wellness Campaign. So she was able to answer some of the technical questions,
Great.
like who we partnered with on certain activities. It's nice to have those specific names, I think, because then it helps you all know as well who our resources are and who can be someone else's resource. But it did not take long.
Great. Yeah. And answering some of those questions in the process kind of helps you to take stock of where you are. That's a great point of that. In the early stages of the process, what have been some of the goals of using the platform as you kind of worked your way through?
So, we only really had this tool at our fingertips for the last couple of months, but I see, I'm looking through this with the lens of a resident and then a lawmaker. So as a resident, I love to look at this and say, oh, well, where do I fare with the rest of the town?
Yeah.
And in terms of as a lawmaker, I look at it and I say, well, where do we need to improve? How can we assess what we see by ways of the data and then reflect meeting the needs of a community? Because what is this data showing? It's literally telling us what the needs of a community are at this time.
Yeah, that's a really interesting point for maybe residents who maybe are just interested in their community. It's kind of a nice tool to just share with them and say, hey, you can find out more about what's going on in the community. And like you said, kind of see where you fall. That's an interesting way of using that. I know that, again, your timeline has been relatively short for when you've had the usable data at your fingertips, but what are some examples of ways that you have been able to use the platform up until this point?
So I will tell you that we managed to host 2 mobile health vans. One was the WOW van, the Wellness on Wheels, and that taught, it teaches healthy eating. And then the other one was, I forget the name of the van, but they did health screens like diabetes screening, and then they offered COVID and flu vaccines. And that was really nice to be able to offer our residents. And I think it kind of came together. The idea was already there with our chairwoman, Laura Zerflu, but then, looking at some of the data that indicated, for example, we had maybe slightly elevated diabetes rates in town. So to have a vehicle that would help us screen some of our residents, that was pretty cool.
Yeah, that's great. And, you bring up a good point that a lot of, especially in smaller communities, we have a sense of what the issues are. We have a lot of anecdotal or, qualitative information about why we think certain services are needed, but it really is important to have the data and the numbers to back that up. And it's really nice when it falls in line and just supports that work that you're already doing. And, in some cases, it can also, I know funding is an issue for a lot of the smaller communities. When you have those numbers at your fingertips, it can really help you to build your case for those opportunities to bring to your residents. That's really great. Are there any issues that were brought to your attention because of the data that you now have access to? So you kind of talked about some of the things that you were already aware of, but was there anything kind of new to you after looking at these numbers?
I think there was definitely quite a few new issues. One issue that we found sort of a little comical is the data indicated that we were what's called a food desert, and we didn't understand that as much. And so looking into the data portal is very good about sort of explaining, what does this mean? What does this metric mean? And so it basically meant that we didn't have food access, healthy food access. I'm assuming like a grocery store within about a half a mile. And so we looked at that, and it was, we educated ourselves on that. But then we also sort of said, hey, although we are listed as a food desert, it doesn't really make us have to do anything too much about it, because the nearest grocery store is not, it's 0.6 miles as opposed to 0.5 miles. So it really isn't that far. But all of that information in general has been very beneficial. I keep going back to the diabetes rates and for myself personally, like I was looking at this all over again today, looking at the diabetes rates, and it's a little bit elevated here. Okay, so how are we going to figure out programming to maybe focusly to address that particular issue? And standing back a little bit from that, saying, is there a particular population of people that we know of that are suffering from this particular disease? So how do we target them in particular? Do we do a programming at the library? Is that where those people meet? Do we do a programming at a temple, at a synagogue, at a mosque, at a church? Like, the idea is not only to put the programming out there, but to make sure it reaches the audience that it should. So this has been very helpful for us. And as we are planning our steps these next couple of months, this is how we are using a lot of this information.
Yeah, so many good points there. I liked I just want to go back to what you said about the food deserts. I think that's a really important thing for people to recognize, that, the numbers don't always tell the full story, even though, of course, we support, we're talking all about how data and needs assessment and collecting this information is so important. And that is true. But at the end of the day, you have to really take a look at what those numbers mean through the lens of your community. That's something that we always talk about through the Mayor's Wellness Campaign. It's not a one size fits all. If you type your town's name into a database and it says, hey, you're a food desert, that may be factually true, but you have to take that step back and analyze the data and say, okay, is this something that we need to prioritize? And in your case, it's not, and maybe it's something to just have on your radar as food insecurity comes up. But I think that's a really good point too, that the numbers are not always going to tell the full story. So that's a really good way of thinking about that. And then, yeah, looking at those, being able to kind of dive into the data at the smaller community and population level is huge. We talk so much, especially since the pandemic, but this has always been true about health inequity and disparities among different groups, and having some of those more specific data points about which communities are really in need and which populations or minority groups or whatever that looks like in your community really does help you to target those programs in a really meaningful way. That's really great that you guys were able to look at that and start thinking about, okay, yes, we need these programs, but specifically, how are we going to reach the populations that are in need of these? That's such an important tool to have. Okay, so how about goals for using the platform? Now that you kind of are up and running, you're familiar with the platform, what are you looking for in this next year as far as working with the City Health Dashboard numbers that you have?
That's a good question. And I anticipate being able to share this information with a lot of different boards and commissions in town. So, for example, if our metrics reflect that we have a population that is unhealthy in one specific area, it would be nice to encourage a business that deals with that area to come into town. So, there's an economic sort of interest here. There's a business interest here. Today, I was looking at the data for life expectancy. And while, life expectancy tells us how long a population may be living, it can also, from another perspective, represent that we have an elder population of people that are not leaving this town. So what do they need? We've had initial conversations about will writing, how to care for the elderly, things that will address the needs of that population. So just with that one number, life expectancy, I can now take that and break it up into so many different pieces to address different needs. And, going forward, I think everybody's going to look at that data and come from a different perspective. And that's what I appreciate about that data. Yeah, such a good point. And I think looking at that healthy aging piece, like you said, it gives you so many different points of intervention. And I liked what you said about using this as a tool to share with stakeholders. It's related to what we were talking about earlier with funding or just advocacy in general. We're in a world now, and this is, I think it's been shifting over the last 10 years, but we really do need facts, data, and real value-based evidence to be able to make our case, whether it be for funding or just for opportunities, just to bring programs, businesses, like you said, to our communities. And this really does give you some of that support to be able to do that. Yeah, thanks for sharing that. That's a really good example. Do you have any advice for towns that are looking to maybe submit this application in the next week or interested in getting more involved with this resource? Well, I think everybody's a winner if they apply. You're never going to know whether you qualify for this until you apply. But the idea that, what will you do with this information? You're going to do a lot, because this information, it's not just about health. I mean, when I looked at the parameters or there was life expectancy, there was health, I was looking at this one number. It was amount of lead in household, something like that. How bizarre, but you know what? It actually is beneficial. It can help you guide your contractors and buildings and the idea of apply so you can have this information at your fingertips is one that I hope everybody takes from this presentation today. The issue of how long does it take to actually fill in that application, it's almost negligible. It really isn't long. But where you will find benefit is if you pin down exactly who the people are that you collaborate with in town, because I think that's a very important piece for someone who's assessing you as a town to see whether this, whether they want to put you on the dashboard or not. I think that's an important piece. You want to know that these people are going to do something with the information you give them, that they're going to collaborate, and who have they collaborated with. If it's if there's state names, names of state organization, that's beneficial. If it's just local, if it's just neighborhood oriented, that's beneficial too.
Yeah, that's great. Really good advice. I love what you said, that there's really no way to lose if you're looking through this. It sounds like even just walking through that application process is a planning tool and kind of exercise in itself. Well, thank you so much. I think that was really helpful. I think the big picture that we heard from Samantha is always great to get that information, but we love to be able to share kind of real life examples from our New Jersey Mayor's Wellness Campaign partners of how they're utilizing these great tools. So thank you so much for that. And I think now we are going to open it up to questions. And so I can see a few here in the question and answers. So is there a limit? This looks like it's for Samantha. If you wanted to jump back on and join us, Samantha, we'll just throw some questions out. Great, thank you. Is there a limit to how many cities applications will be accepted?
No. So last year we had originally set that it was going to be 10 cities, but then we got so many amazing applications that we ended up accepting 29 cities to the challenge. And this year we're not kind of putting any kind of like upper threshold to the amount of cities that we end up accepting, because in terms of like the data and like the workload for our team, it's basically the same to a certain extent. So yeah, there will be no limit. Great.
Thank you. Okay, let's see what else we have here. How often is the data updated? Samantha, I'm assuming that's for you as well.
Yes, our data is updated. Each metric is updated at least once a year. Yeah, once a year.
Great. That's really, we've worked with a lot of different platforms, and that's pretty frequent. I have to say, that's impressive. Yeah. Okay. Am I able to combine the data with other sources of data that is collected locally?
Yes, that is like a very, very, very key thing. All of our data is accessible and downloadable by either CSV files or an API. And we highly, highly, highly recommend using our data in conjunction with other locally collected data or other data sources, kind of to Iman's point about, integrating the numbers with like what, users know to be true about their community. We do not expect our data to be used kind of in a vacuum. And the story becomes much more crystallized when it is used in kind of context or placed in context with local perspectives, local expertise, local data.
Great. Yeah, and that's really in line with what we recommend through our Mayor's Wellness Campaign as well. We offer so many through our handbook. If you guys have not seen that, it's on our website where you can reach out to me and I'll make sure you get the link. Lots of different suggestions of where you can pull that data. And I think, as Samantha mentioned, if you have access to it, take a look at it and see what makes sense and kind of use it all together. You're not there's no negative downside to looking at different options. Okay, how often do you add new metrics?
So we've added, it depends. It's really based on, like, for example, when COVID hit, of course, we needed to provide some sort of measure that looked at COVID. And so we added that in 2020. And as we've grown and like new problems or new challenges come to the forefront, there are data that can kind of back up and provide context to those challenges, we will provide data for those things. So it's not like it's like one measure a year or two measures a year. Like last year, we did end up providing 2 new measures. I think it's usually between 1 and 2 every year.
Great, thank you. And if your town is selected for the dashboard, how is that data collected?
So all of our data is collected from national data sets. So like I said, like we use, for example, the American Community Survey, which comes from the US Census. So we just end up pulling. So when we, update our data for our existing 900 cities, we will include all of the new cities in those data pulls from our various data sources. Like I said, the census, the National Vital Statistics System, proprietary sources. So we will just kind of lump in these new cities to then provide that data along with all of these cities that we currently provide data for.
Great. And I think that actually answers your question, Jennifer, about, if you're applying, you're not providing the data to them. That's the benefit of applying, is that you'll be getting that data from the dashboard. That's a good question though, Jen.
Exactly. Like I said, I should have even put this in the slot in that slide. This challenge, or this opportunity, is a totally free, very we don't want, we know that this data is hard to come by, it's hard to analyze, and so we want to do all of the heavy lifting and all of the work for our smaller communities. So once summer 2023 comes, all they have to do is just log on to the site, type in their city, and they have access to all of this data analyzed for their local community.
Great, thank you. And then is there a specific time of year when the data is updated?
It really depends on the data source that we use. So, some data sources like the census always are updating their data around December. So then we kind of update our site accordingly in February. So we have times where we will update our data. We usually have a data update schedule of 3 times per year or 2 times per year. And so that's when you can see the data updates to the site for all of the various metrics.
Great.
But we communicate all of that through our, I can drop a link to our newsletter. And so we will tell you when data gets updated if you subscribe to our newsletter or you follow us on social media. That's
really helpful. Yeah, if you want to drop the link, I'm sure folks would be interested in that. That's great. Any other questions before we wrap up here? I think we covered all of them in the chat. I love to see everybody using the chat, and just really, it seems like people are excited about this topic. So that's great to see. If I missed anybody's question and you want to just retype it really quickly, do that. Otherwise, I think we can wrap up. Okay, not seeing any more questions. Katie, if you just want to throw up our last couple of slides and we will close out. Yeah, so I just want to take a quick minute to thank all of our Mayor's Wellness Campaign sponsors. Without their support, we really would not be able to do this work and work with you in the communities. So we want to say thank you to them. And okay, so I just want to again thank all of our speakers today. Oh, let me just answer this last question. What is the limit on population to apply?
The limit is so at the bottom, it's 3,000. So your community has to have a population of 3,000 at the lower threshold, up to 50,000. So no city that has a population of over 50K will be eligible. It's only in that 3K to 50K range.
Great, Samantha. Okay, so again, thank you guys for joining us today. The speakers were great. We really appreciate having you all as partners and hope that this was a useful presentation for everyone who is on the call. I do want to just let you know about a couple of Mayor's Wellness Campaign events that are coming up before we head out. The first will be on March 8th. We're going to be hosting a youth mental health first aid training. The registration has been sent out for this, but if you did not receive it, feel free to reach out to myself or to Katie if you would like to register for those trainings. I know a lot of you on the call have participated, so feel free to share those with your colleagues as well. And then additionally, in keeping with this theme of the importance of data, we're really excited to having partnered with WellCare to offer an in-person workshop focused on local needs assessments and data collection. The workshop is going to include community leaders who have used local data to implement targeted and meaningful Mayor's Wellness Campaign programs and give participants the opportunity to hear from each other, similar to what you heard today, on best practices, successes, and challenges. So the program is going to be in June, and we'll certainly be sending more information out about that, but I just wanted to give you all a heads up about that, since it's really connected to this work that we were talking about today. Remember that Quality Institute staff is here to support you and the work that you're doing in your communities. Feel free to reach out to me at any time if you need any assistance on the work that you're doing. And thank you again for joining us. I hope everybody has a great day.
Thank you.
Julie and Katie, thanks everyone.
Thank you.